Now, please welcome Brie Jackson back to the stage, along with Patrick Quigley, co-founder and CEO of Sidecar Health.
How's everyone doing? Great, good. Thank you for answering that. Oh, Patrick, thank you for joining us.
Thanks for having me.
So we want to talk a little bit about Sidecar Health. The mission is to make quality healthcare affordable and accessible to everyone. How are you achieving this?
Well, I think the real thing is, how do you break down barriers to care? And you had kind of mentioned this before we got on stage, if I'd be willing to talk a little bit about my personal journey. And so everyone's healthcare journey is, especially if you're an entrepreneur, entrepreneurship is very personal. So I have 3 kids, very fortunate. My wife and I have 3 kids. And when one of my children was very young, we had a lot of healthcare issues that we had to deal with. And I'm not traditionally a healthcare guy. I'm a mechanical engineer, which would be held against me at every possible moment. So when I needed to access my health plan, I did something crazy. I read my policy. How many of you guys have read your policies? Fantastic. So I read my policy and I realized kind of what my out-of-pocket maximum were, how to kind of get care, because when my son was diagnosed, I was told I needed prior authorization to get access to the care that I needed. And then once I got prior authorization, I was told it was a 6-month waiting list to see the specialist that I needed to do. And I was just approached by my doctor, said, hey, if you can afford to go out of network, you should. And so I read my policy, figured out what my out-of-pocket maximum was, and figured, okay, the $6,000 that I needed to spend, that's worth it, that's what money's for, let's start care. And that's when I started getting bills. And I got $58,000 worth of balance bills in the first year alone. So as I sit back and think about kind of what our mission is and the context of what we're trying to do, it's with that in mind. Like, how do you break down the barriers to care? Because no one should be in my situation. I felt very fortunate that I was able to manage through that to get my son the care that he needs. And really what we're all about is making sure that no family is in a situation where they can't get their son the care that they need. And for us, it's about how do you go and eliminate those barriers, if that makes sense.
Yeah, absolutely. So talk to me about how does this happen? How do you do this? How are you able to control costs but increase access?
Yeah, so we are a major medical health insurance plan, but what makes us singularly unique is we bend the cost curve while at the same point increasing access to care. And we do this without subsidies. Right? So we're not subsidized by the government in any way. The way we do that is very unique in that we leverage the power of consumers. Right? So our view of the world is that to fix the US healthcare system, you need to actually go ahead and introduce transparency. Everyone talks a lot about price transparency. That's critically important, but it's more than price transparency. It's also quality transparency. So what we do is we introduce transparency into the decision processes that consumers go through around planned healthcare. And then we introduce incentives for people to be engaged with their doctors about making care decisions. Because one of the common kind of thought processes around health policy is that consumers, it's hard to navigate the US healthcare system, and certainly it's complicated. But consumers are incredibly good, actually, about identifying what they need and actually going and getting it. And so what we do is, again, thinking back to my own personal experiences, is we eliminate the traditional barriers to care. Like, we're the only health insurance plan with no prior authorization. We don't have preferred networks. We don't have contracted networks. We don't have any of that. We don't have step therapy. We don't have formularies. We think that care should be determined by doctors, and our job is to figure out how do we go ahead and pay for it. Right? So hopefully that sounds good to everybody, right? Who doesn't want a plan with no prior authorization and no restraints? So that's how we do it. The way we're able to afford it then becomes, I think, what's so important. And that is actually empowering the consumer with information, letting them know what the quality of a doctor is, know what the price of a doctor is, and when they have abilities to make decisions, have them make decisions with incentives, knowing the trade-offs that they're making.
And can you go a little bit further into that? So how is Sidecar Health offering employer-facing alternative health insurance?
Right, so again, we're a major medical health insurance plan, just like every other kind of major medical health insurance plan, from everything that you care about. What we are different in is in everything that you don't like about your traditional health plan, right? So everything that we do is via our app, right? So we have an app that you can actually see, wait for this, the price of every doctor in the United States is available transparently through our app. So you can actually see what your doctor is going to charge when you're going to go in for planned care. Maybe you need to go see a cardiologist. At the same time, quality ratings. We take outcome-based ratings, appropriateness of care ratings. We put that into the app. And so then we go ahead and tell you, it's like, okay, I know that we define access to care by, when we enter into a particular market, we basically define a benefit amount for anything that you might want to go do in the US healthcare system. And that benefit amount is determined by the commercial rates, what prices you can actually access that for in that local market. And we basically say, okay, if you take that benefit and you want to go to a place that charges more than that benefit, that's your choice. There's no medical reason to do that, but maybe you really like the waiting room at this particular doctor's office. So you'll know ahead of time and you'll be responsible for paying more than that benefit amount. Likewise, if you decide to go to a doctor that charges less than our benefit amount for that planned service, you get to keep half of that savings that you save. And that changes everything. A simple example is, let's say you're filling your statin, right? So maybe at one name brand pharmacy, and let's pick on anybody, maybe it's going to cost you $40 to fill your prescription there. But maybe if you filled your prescription at a grocery store, you actually get paid $20. And so suddenly it changes how you interact. Suddenly, prescription adherence is very high, so you stay healthier, and that leads to lower cost overall. Does that make it more real?
Absolutely, absolutely. So right now, there's a big focus, I don't know if you ever heard of it, about Make America Healthy Again.
Of course.
It's something that we've heard several times.
Yeah.
And part of that is addressing chronic diseases, things
100%.
like obesity. And what role is Sidecar playing in all of this?
Well, again, we think some of the core principles around the MAHA is really around access, right? How do you break down access to care? And again, this comes back to why we have no prior authorization. One of our things that we highlight a lot is, like, again, we really put the emphasis on doctors. So if you think about one of the priorities being, how do you shrink the time to get care? With prior authorization, maybe you need to go get an MRI, but because of your health plan, your doctor is saying you need to get a CT scan first to get access to that MRI. Well, that delays care. So we don't do those things. We want doctors making care decisions. We, as a result, by the way, see a much higher utilization of primary care. We see a much higher utilization of mental health care, so 50% higher mental health claims on our plan than others, because we have no constrained networks. You're never on a waiting list to try to go get access to care. So if you think about all of those things together, we're able to actually increase access to care for things where it lowers the cost of care, and this is where it gets to bending the cost curve. Things like emergency room visits, which drive higher cost. We see 45% less emergency room visits on our plan because people are not prevented from getting care. They're not ending up in emergency situations. We see appropriate site of care. Like, let's think about imaging. Like, you don't need to get an MRI at a hospital. You can get the same MRI at a standalone imaging center. That's dramatically less expensive. So by helping people, creating financial incentives for people to make those decisions, it frees up dollars for things that are really important, like preventive medicine.
And when we think of healthcare, we typically think of the doctor-patient relationship. Mm-hmm. But nowadays, more and more, AI has a role in things. And I guess, what role do you see AI playing? And then what are your priorities for AI?
100%. Well, so we don't really have an opinion on AI in terms of care delivery. I think there's lots of questions. I think one of the previous panelists talked a lot about, hey, you want to be really careful about bias. What we think about AI for is actually unlocking the consumer experience. Like, for example, let's say your family has a basket of prescriptions that they're on every month. The way we use AI is to help consumers know, within 5 miles from your house, where is the pharmacy that for your entire basket of prescriptions your family is using. This is the place where is the most economical for you, where you get the most cash back. Or if I'm trying to pick a cardiologist, we can use AI to help you identify what all your choices are in a given area, what their prices are, and ultimately set up an appointment for you. Even beyond that, think about billing. Like, a single view of your medical records, you can use AI to go out, integrate with systems, pull them in, and actually have a one view, even though my specialist might be in a different system, my imaging might be all over. So AI is a huge unlock for consumers, and that's where our focus is.
Do you see AI disrupting the industry?
Well, the word disrupting is really interesting. A lot of people try to kind of pull that into things like, we don't think about disrupting. Let's talk about empowering. Mm-hmm. So we think about it as empowering, again, consumers, and we believe that the only way to really fix the US healthcare system is empowering consumers, to really break off all these barriers to care that have been put in place to control costs, but really all they're doing is actually preventing people from getting access to care.
And I know in the previous panel, there was talks about Apple Watches,
yeah,
technology, and I guess talk with me about that landscape, the role of, wearable health tech.
I think anything, again, that increases health literacy is critically important. This comes back to kind of from our model is we have doctors and patients teaming up on their care. In a traditional legacy model, the payer is pushing themselves in there and controlling what that right path is. So I think wearables do a great job of creating more engagement, which is very consistent with what we think. We want people to be engaged in their healthcare decisions, know what's going on as they're engaging with things that are going to affect their lives. And wearables just gives you more data to make better decisions, which is very aligned to how we think.
Now, this is something I watched a couple of podcasts that you've done.
Uh-oh.
And this was something that really stood out to me. The company has less than a 1% denial rate for Sidecar, and that is far below the industry average, and also has no formulas and step therapy requirements. Now, can you talk about ways that Sidecar is removing barriers to accessing healthcare, and how are you making all of that work?
Yeah, no, and that's exactly right, and I appreciate you kind of highlighting that stat. It's actually way below 1%, but marketing won't let me talk about that. Like, our whole view of the world, again, is that doctors are making care decisions, and our job is to make sure they're paid for. And so if you just look at the view from that, if you look at the world from that picture, and again, I go back to my background not being a deep healthcare person. I'm an engineer. I'm trying to work backwards from what do I want care to be for my family, and how do we empower that? And so for us, it's no surprise we have no formularies. It's no surprise we have no prior authorization. It's no surprise that we are having a very low denial rate relative to the industry. Everybody should be working towards that. How we make it work is because of the unlock for consumers. Like, again, I'll just use an imaging example because it's easy. Like, you can literally spend $5,000 for an MRI in one location, or $500 for the exact same MRI on the exact same machine at another location. And if what we do is say, look, I'm going to give you $1,000 to get your MRI, go wherever you want, what are consumers going to do? Well, they're going to look at the quality that they're getting. It's the same. They're going to look at the financial choices. Well, one, I'm going to pay thousands of dollars. The other, I get paid to get care. Well, first of all, I'm going to run out and do that right now because it's going to be helpful for my doctor. I have no steps that I have to go through to get that. And then once I get that information, I can speed care, and that's going to lower the overall cost. That's what we see in the claims data. So that's how we do it.
And I think for myself, even when I go to make an appointment, it can be overwhelming 100%. For me. And I guess you've touched on this in your example, but can you talk a little bit more about how Sidecar Health is empowering consumers when it comes to making decisions?
Yeah, I mean, again, think about everybody's personal experiences. Has anyone here ever received a surprise bill? Yeah, right. So we're trying to avoid that. So like through our app, what you're going to see is you're going to see Dr. Patel. Dr. Patel, if you go see Dr. Patel, you're going to pay $20. And that includes everything that's going to happen in that particular episode of care. Like if you go in and he's a cardiologist and you've got an EKG, you weren't expecting that. How would you know? So all of those things can end up being surprises in a traditional situation, and ours is completely transparent. Likewise, you're going to see their quality ratings, and you're going to say, well, maybe I want to go to this other cardiologist where all that's true, actually, and then I get paid $10. Wow, that's like a negative copay. One of the things that shocks most people as they learn about us, our average family that's on our plan every year gets $1,000 cash back, while not having barriers to care, while their premiums are about 20% lower than what you typically see on a traditional network-based plan because of all the barriers to care. So that's how.
And right now, we've mentioned this several times, but we are in the midst of a shutdown.
Yeah.
And when it comes to lawmakers, when it comes to the administration, what more would you like to see from lawmakers when it comes to healthcare?
Yeah, I mean, for us, it's really about transparency. What can we do from a policy perspective to facilitate increased visibility into what things cost, increased visibility into the quality of doctors? So let's just empower consumers to have all the information that they need to make care decisions, because that is there's no stronger, kind of more efficient market force to create value. And you see it in every industry other than consumers. So anything from a policy perspective we can do to increase the ability for consumers to navigate with their doctors, I think is going to be better for everybody. Looking
ahead, what's the biggest change that you think we'll see in the industry over the next year?
Over the next year is a pretty narrow time frame. I'm hoping we get back to work. For me, again, I think that you're seeing increasing conversations about prior authorization. That's very exciting. So I think there's going to be more and more pressure. I hope we turn that pressure into more action to eliminate a lot of the prior authorization that the system is built on today. And so for me, I'm hopeful that could be solved.
And in that answer alone, I heard you say hope and hopeful.
Yeah.
What are your hopes for the industry moving forward?
Well, every entrepreneur is super optimistic about the future, I think. So my hope might sound a little bit, surprising, but I hope people copy us. Right, so like at the end of the day, every day, our team, this great team, wakes up and we're trying to make healthcare better for everyone. We believe we can lower the cost of care, increase access for everyone. And I think the big change that we need is we need consumers more at the forefront of their care decisions with their doctors. And if all of the traditional players that we all know and love, like if they can start copying us more, that's going to move everything. It's going to move policy. That's going to move everything more towards this future where we don't have the same barriers. So I'm hopeful that we get copied.
All right, thank you. Patrick, appreciate your time.
Well, thanks for making the time for me. Appreciate it.